Once you've been checked in the anaesthetic room, usually you'll be sitting on the side of the operating table that's been brought into the anaesthetic room. So the anaesthetic room is separate to the room that you have your operation in, but it's next door. So you're in the anaesthetic room, you're sitting on the table, we've checked you in. We'll usually put a little plastic straw into a vein. It's called a drip, but it's basically a straw. They're quite small. You can have a bit of local anaesthetic to numb the skin. Occasionally that stings a little bit, but rapidly goes numb. Put a little straw in the vein, usually in the back of your forearm. Put some tape on it, and we usually give 2 different antibiotics through that drip. We will talk through what position we want you in for your injection in your lower back. Basically, it's chin on chest, shoulders slumped and curled forwards, but we'll show you the particular position we want at the time, so don't worry, you don't need to try and remember what to do. Sometimes I will give a small dose of something into the drip that makes you feel a bit dopey and much more relaxed. Not only might that make you find having an injection in your lower back more acceptable, but it also may well help me because it makes you relax and makes it easier for me to complete the injection in your lower back. Don't be surprised that your anaesthetist will usually have a face mask on and some sterile gloves, and they may or may not put on a sterile apron. It depends upon your susceptibility to infections, amongst other things. The anaesthetist will be behind you but talking to you. Once your skin is prepared on your back with some cold spray, they'll put a bit of local anaesthetic to numb the skin in your lower back, and then through that numb skin the anaesthetist will pass a thin needle through which they'll inject a single dose, a little dose of local anaesthetic, and then the needle comes out, and you just have a tiny little hole that seals up immediately where the injection's been. For hip replacements, you'll be on your side during the operation. That's of interest to the anaesthetist because it means your airway between your lips and your voice box, that airway will tend to stay open, even if you have something that makes you quite sleepy or unconscious during the operation. In contrast, people who have knee replacements will be on their back, and although the knee replacements can be noisy, we have to rather more carefully adjust how much anaesthetic you may have to make you sleepy, should you wish to be, because if you have a lot, we may then compromise your airway and then have to use various little plastic devices to keep your airway open. But that's more detail to talk to your anaesthetist about. Your anaesthetist will write up the tablets for you for pain relief afterwards, and usually you'll have had a dose or 2 before you come to the operating theatre. Again, your anaesthetist will go through all your allergies and so on and make sure that the medicines they prescribed are suitable for you. The exact technique of the anaesthetic delivery, both the injection in the back or the general anaesthetic, may well vary and depend upon your personal characteristics and your personal experiences in the past. So please tell us any problems that you've had with anaesthetics in the past and anything you would like us to make better than last time. We always want to give you a better experience than you've had previously, so please tell us.